Hi, I'm Dr. Shoshana Bennett, clinical psychologist. There was an article in BMC Psychiatry that was focusing on the prevalence and the risk factors for depressive symptoms and anxious anxiety symptoms during the first trimester of pregnancy during the pandemic. Actually, focused also in China. So it was quite specific. But from the conclusions, from anecdotally, I can tell you, we can pretty well generalize to the rest of the population. But this is not a research study I'm giving you now. I'm just talking about a research study that had been done, and it is my anecdotal experience to say we can most likely generalize this. What was found is that during the pandemic, the depression symptoms and the anxiety symptoms were actually higher, both in the pregnant person and the partner, than is normally found. And depression is actually quite high. Perinatal depression is much higher than in the general population or at other times in people's lives during pregnancy. And postpartum, I should say, but we're talking about pregnancy now. So it's higher anyway. But the statistics found were even higher than usual. And what I want you to know is that when there's any health risk, especially to the one who's pregnant or to the baby, whether it's a real health risk or an imagined one, or one that's in the mind, like here's what could happen, a possible health risk, it automatically increases the chances for a perinatal depression or anxiety. So again, my message is whether there is anything going on in the environment, whether the flu is going around, whether there's COVID happening, whether no matter what, watch your pregnant friends and loved ones, because the chances of getting depression, if it's going to arise at all, it typically happens during pregnancy and or the postpartum time. But if they are feeling like there might be a health risk, the chances of depression and anxiety rise.